muscles of tongue are divided into skeletal and proper muscles. Proper muscles change shape of the tongue and the oral cavities. They don't move it, they just change it. And there are skeletal muscles, they can move it upward, downward, backward, forward in different directions. So let's start with this. Some skeletal muscles continue with the proper muscles and the thickness of tongue. So let's start with the first one. It's visible on the sagittal section of the head. It's known as genioglossus. Genioglossus muscle starts from the mental spine of the mandible and then it goes directly to the tongue. And also in the thickness of the tongue, it continues as vertical muscle. So look at the section. This is genioglossus, but in the tongue we have vertical muscle. Genioglossus muscle moves down forward out of oral cavity anteriorly. Vertical muscle makes our tongue flat, like it becomes wide and flat. Vertical muscle. Then there is one more muscle. It belongs to soft palate and to the tongue at the same time. It's palatoglossus muscle. It's present in the palatoglossal arc of the soft palate. So if you move tongue downward and soft palate upward, unfortunately that fold was destroyed, but it would be here because you can see this is the tissue, like with some creeps on its surface. It was a palatine tonsil, and we know just in front of it we have palatoglossal arc with palatoglossal muscle, and behind it we would have palatopharyngeal muscle. So they would be here, but you can examine your oral cavity and you will see them. If you move your tongue forward, you will see that falls. Have you ever seen your tonsils, palatine tonsils? No?
Yes.
Look at your oral cavity. Look at the mirror. You will see. Use some flash and look at the oral cavity. You will see. That tonsils are really visible.
Yes.
So because each doctor should be able to examine oral cavity. Are you gonna be a doctor? Да.
Yes.
So please examine your oral cavity by yourself. Да, вы хотите быть хорошим? Yes. So please examine your oral cavity, and you will see palatine tonsils. Palatoglossus muscle moves tongue backward and upward in direction to the soft palate. But in the tongue, it continues as transverse muscle. So transverse muscle you can demonstrate, like you should put perpendicular, like your forceps perpendicular to the tongue, so it's transverse muscle, or it goes in the transverse direction in the thickness of tongue, like that. So we demonstrated on the sagittal, on the full tongue. Transverse muscle makes your tongue narrow.
Shape or shape.
The shape, just shape. Or transverse muscle also helps to move a tube by your tongue. It's transverse muscle. Yes, you're right. Then next one. Also, we can demonstrate like the rotumum genioglossus, hyoglossus, and then styloglossus. So, if you look at the midline on the inferior surface of the tongue, here the most middle is genioglossus muscle. Then next one little bit laterally here we have hyoglossus muscle from the hyoid to the tongue. It moves tongue backward and downward when you swallow. According to that, due to that muscle, your root of tongue presses on the epiglottis, closing inlet of the larynx, and your food doesn't go to the airways. Then the last one is styloglossus, most lateral, so it would be here, styloglossus muscle, from the styloid to the inferior and lateral aspect of the tongue. It contraction produces like movement of the tongue upward and backward. It moves backward and upward. In the tongue also we have two more proper muscles, superior and inferior longitudinal muscles. Superior and inferior longitudinal, superior one just below the dorsum, mucosa of dorsum, and a little bit lower we have inferior longitudinal muscle. Superior and inferior longitudinal muscles, they make our tongue shorter. So here we demonstrate superior longitudinal, here inferior longitudinal muscles. That's all about the tongue. Then after